Hello, I'm Dr. Soran Hassan Zangan. I'm a specialist of internal medicine. In this third video of the series about diabetes mellitus, I'm going to talk about the symptoms of diabetes mellitus, and also I'm going to answer one of your questions. The question is, does prediabetes have any symptoms or signs of it? So regarding the first part, the symptoms of diabetes mellitus varies from a person to another, and usually the most common symptoms are feeling of thirst that is recurrent and severe, feeling of hunger that is recurrent also, and recurrent visits to the toilet for urination, and waking up at night for urination one or more times, the feeling that irritability, the patient being irritable, easily irritable, abnormalities in the vision like blurring in the vision, delayed healing of wounds, or the wounds are not healing properly, frequent infections mainly in the skin, and also other type of infection, bacterial, viruses, fungal infection in the fingers, in the toes, in the genitals, in the mouth. These are the main symptoms of diabetes mellitus. The symptoms in type 1 diabetes usually develop quickly and become severe, so the disease in type 1 diabetes usually is diagnosed early, while in type 2 diabetes mellitus, unfortunately, the symptoms gradually increase and takes a long time to reach its peak, so the patient might remain years without knowing that he's having type 2 diabetes. And this is usually the problem. That's why we encourage people to routinely, if once a year or if possible more, to do a blood sugar test. Regarding the answer for the question, does prediabetes have any sign or symptom? Unfortunately, most of the cases of prediabetes have no sign or any symptoms, but some of them have signs of insulin resistance. That is called acanthosis nigricans, in which the skin, usually the skin around the neck or the armpits or maybe other parts of the body, becomes thicker and becomes darker in color, between violet to brown in color, and have a velvet nature and velvet appearance. This is an indicator of that the body is having insulin resistance, and it is not specific to prediabetes alone. It can occur in prediabetes, in diabetes type 2, in gestational diabetes, in polycystic ovarian syndrome, in any other endocrine disease. At the end of this video, if you have any questions, you can write down in the comments. We will try to answer them in the comments or in the subsequent videos. At the end, if you found this video useful, please share it to reach as much people as possible to increase the awareness about diabetes mellitus. Stay safe.